Good morning, everyone. This is Linda, and I will be presenting to you the competency model for professional rehabilitation nursing application to practice. Just in case you guys don't know who I am, this is me. I was told that we would be in two separate rooms, so just letting you guys know if I'm not with you guys, I'm in the other room. So, what is rehabilitation nursing? Rehabilitation nursing is a philosophy of care, not a work setting or phase of treatment. We, as rehabilitation nurses, assist our patients' families achieve and maintain optimum function in interaction to help restore freedom and independence again when they return to their community and home. We work with patients of all ages, their families, or caregivers after the onset of a disabling injury or chronic illness. We work in different settings and roles. We are collaborators, educators, care coordinators, and advocates, working with many other specialists and health team members doctors, physical therapists, occupational therapists, speech therapists, and neuropsychiatry to create a comprehensive care plan based on patient goals and maximum potential. I really like this quote that I saw on the ARN website about rehabilitation nursing. And it said, saving the life is the first priority, then the rehab nurse moves in and restores the living. And moving right along to our professional rehabilitation nursing competency model. It is an evidence based framework and is created by the Association of Rehabilitation of Nursing, ARN, task force comprised of experts representing clinical and academic settings to help guide our professional rehabilitation practice. It identifies 14 essential role competencies across 4 distinct domains, 3 levels of nurse proficiency. First being the beginner nurse. This would be a rehabilitation nurse in the practice of 1 to 2 years. And the intermediate nurse in the practice of rehabilitation nursing from 3 to 5 years, and usually they have obtained their CRRN. And our advanced nurse are nurses in the practice of rehabilitation nursing for 5+ years, and they could take the role of a staff nurse, but also educators, CNS, APRN, or administrators. So, in the competency model for rehabilitation nurses, there are 4 domains, which include the nurse led evidence based intervention to promote function and health management in persons with disability and or chronic illness. And the second domain is the promotion of health and successful living in persons with disability or chronic illness across lifespan. And the third domain is leadership, and the fourth domain is the interprofessional care. We will visit each domain in the next slides. And what I really like about our competency model is that it centers us in the middle, like so. And we're surrounded by the 4 domains and competencies that we should develop to be good rehab nurses. The first domain is nurse-led interventions, and not just regular interventions, but evidence-based interventions to promote function and health management in persons with disability and or chronic illness. Among this domain, there are 4 essential roles, and they include providing client and caregiver education, implementing interventions based on evidence-based, use supportive technologies for improved QOL, and deliver client and family-centered care. I have picked one competency, 1.4, deliver client and family-centered care, to apply how we can apply that competency to our practice. This chart on the bottom shows the proficiency levels and the descriptors of a beginner nurse, an intermediate nurse, and advanced nurse. And the next slide, we'll go over a case scenario and apply these concepts to our practice. Case scenario: family team conference. Linda is working a day shift and is informed over NKE that there will be a family team conference happening today with the patient's family. Linda seldom works day shift and not very knowledgeable of family team conferences. Everyone in this room are shifted to work with Linda today in their current roles, create a dialogue, and collaboratively provide feedback together on how Linda can prepare and contribute to a successful family team conference. Identify the feedbacks with which level of competency the nurses exemplify: beginner, intermediate, or advanced. So I have here the competency proficiency level and descriptors for you to look at, and we will stop the slide here for a little bit and have a dialogue and talk about how Linda could have a successful family team conference. Domain 2 is the promotion of health and successful living in person with disability or chronic illness across the lifespan. And among the promotion of successful living, there are 3 essential roles: promote health and prevent disability, foster self-management, and promote and facilitate safe and effective care transitions. The rehabilitation nurse provides education and plans for patients to manage disease and disability with maximal independence in the home living environment. Rehabilitation nurses identify client and caregiver needs and integrate community care services that manage chronic disease and supports health over time. The domain targets the role that the rehabilitation nurse plays in promoting overall successful living through risk reduction, harm prevention, and maintenance of optimal health. Of the 3 essential roles, I have picked foster self-management as competency 2.2 for the next scenario. Fostering self-management is a collaborative approach that incorporates the client's self-efficacy, patient experiences, and health literacy to problem solve and make decisions about his or her health care to achieve the highest quality of life while living in a chronic illness and or disability. Case scenario: applying bowel and bladder training program to foster self-management. Linda is back. She is pulling a double today and working evening shift. She receives a patient with diagnosis of stroke during NKE. She receives and report that this patient has been incontinent of bladder 4 times and incontinent of pasty stool or bowels 3 times in the past 24 hours. Patient was admitted yesterday afternoon. Linda is a certified rehabilitation registered nurse and a rehabilitation nurse for 5 years. Can you guess what her plan of care and goals will be for the patient on this shift and going forward? Can you describe how her teamwork will look like to coordinate her care for her patient? We will stop the slide here in Competency 2.2, Foster Self-Management, to have a dialogue over the case scenario. Great, so now we'll move on to competency number 3, leadership. The 4 essential roles of leadership include promote accountability for care, disseminate rehabilitation nursing knowledge, impact health policy for persons with disability and or chronic illness, and empower clients to self-advocate. Rehab nurses at all levels are key in empowering clients and families to be self-advocates. They routinely collaborate with other professionals and organizations and influence health policy to promote optimum care across the continuum for individuals with disability or chronic illness. The professional rehabilitation nurse is a qualified team leader and a competent key partner in a successful rehabilitation program. The leadership domain highlights competencies which focus on accountability, advocacy, and the sharing of rehabilitation knowledge with clients, families, and other members of the interprofessional team. So I picked competency 3.4, empower clients to self-advocate. as our discussion topic for this proficiency level. And last but not least, our competency number 4, interprofessional care. Interprofessional care is comprised of 3 essential roles, which include develop interprofessional relationships, implement an interprofessional holistic plan of care, and foster effective interprofessional collaboration. An integral part of the rehabilitation nurse's role is the ability to effectively communicate and collaborate within an interprofessional team. The rehabilitation nurse's role as the member of an effective interprofessional team is instrumental in the development and implementation of a rehabilitation plan of care that uses the best available evidence to promote desired quality outcomes in a diverse client population. I have picked Competency 4.3, Foster Effective Interprofessional Collaboration. When I see that, foster effective interprofessional collaboration, I immediately think of team and our team meetings during the day. So I thought we could just have a dialogue and talk about the different proficiency levels of each nurse in a beginner, intermediate, advanced. So we'll keep this slide open and talk about TPOC and team meetings. Great. So, aside from applying all these great competencies to our nursing practice, I've come up with a couple other ways that you could grow within your rehabilitation nursing role. And that includes you could become a member of the ARN, a national professional organization. You can be involved in your local NorCal ARN chapter. You can become a CRRN. You can also attend the yearly National ARN conferences and yearly NorCal ARN chapter symposiums. I actually love going to these conferences and the chapter symposiums because you get to really network with all the different rehab nurses around the world. Yeah, it is around the world. It's not just national. You have people coming from out of country to contribute to our practice of rehabilitation nursing. And we have one just locally, yearly. We weren't able to have one this year for our local chapter because of COVID, but we normally have one every year, and we talk about different topics. You get to meet other rehab nurses in the local area. And it's just so awesome to see what other people are doing and to share all the great things that we are doing in our unit too. So for this year, the National ARN Conference is going to be virtual, and it will start on October 21st, and it will have live webinars and live presentations up to the 24th. But you have 30 days to go back to review all the content, posters, presentations, and just everything that was offered during the conference, the 4 days of the conference time. So you have 30 days to go back to review it and view it again. And just a reminder also that Kaiser pays tuition reimbursement up to $2,500. So please don't put it to waste and utilize the money. And if you need help putting the application process in to get reimbursed for the conference, please let me know. I have attended quite a few times already, almost 5 years I've attended, so let me know and I'll be more than happy to help you get your money back. And I'm thinking about putting around a sign-up sheet if you're interested in